Good afternoon, everyone. This is Katie Cook from Adirondack Health Institute. Welcome to the Telehealth Learning Collaborative. This is our first session of 2019. We do these every other month, and this Learning Collaborative, if anybody is new to the webinar, is a joint effort between Adirondack Health Institute and Fort Drum Regional Health Planning Organization. Together, we form the North Country Telehealth Partnership. Today's webinar, we are going to start with speaker first. Our speaker today is Dr. Frank Corigliano. He is a New York State licensed clinical psychologist and president of Healthy Connections. Healthy Connections Psychological Services primarily works with skilled nursing and other medical facilities to meet the quadruple aims of healthcare reform by providing crisis and ongoing behavioral health care, including assessments, diagnosis, and treatment of psychological, emotional, and behavioral issues. He focuses in expanding telemedicine to rural communities here in New York State. Through Healthy Connections, Corigliano is committed to closing gaps in access to mental health care. Additionally, consultation and workshops for doctors, health professionals, and administrators who seek to reduce overall costs, improve patient care, and satisfaction. As president of the New York State Psychological Association's Independent Practice Division, accountable to over 400 members and spearheading outreach, cultural competency, and innovation initiatives. His education includes a BA in psychology and business studies at Oxford University, and a PhD in clinical psychology from St. John's University. I'm going to turn it over to Dr. Corigliano. So Corigliano, whenever you're ready. Just bear with using a new platform, so we're just trying to make sure audio is working. If throughout, please submit them through the Q&A box, which should be at the bottom right of your WebEx screen. We'll be monitoring questions throughout the session, answering them at the end. Get her. And again, just bear with us. We're trying to get Dr. Corigliano set up with the audio. It is the first time using a WebEx platform, which is generously hosted by the New York State Department of Health in an effort to allow more attendees to connect, because what was happening in 2018 was we were in a different platform and it only allowed 100 individuals to connect, and we were maxing out capacity. So this allows us to have up to 500 attendees, and we are just working out the kinks. So bear with us like 2 more minutes while we get him set up with audio.
Hello, this is Dr. Corigliano. Can I be heard?
Yeah, I do hear you now. Excellent.
Excellent. Shall we begin?
Yes, you can go.
So my name is Dr. Frank Corigliano. I'm a clinical psychologist right here in New York, and I'm president of Healthy Connections Psychological Services. What I'd like to do is provide an overview of telepsychology, introduction to telepsychology for skilled nursing facility and medical facilities, and also give a little bit of a background about how telepsychology can be used in settings to achieve the quadruple aims of healthcare reform, including reducing overall costs, improving patient care and satisfaction, improve patient health, and also the new fourth one that they're talking about, which is really critical in the rural areas, is increasing provider and clinician satisfaction, increasing efficiency and reducing burnout, because staffing is very difficult. With that, I'll give a little bit of my disclosures. So as I said, I'm president of Healthy Connection Psychological Services, which is a boutique psychological practice specializing in telemedicine for rural New Yorkers. Also have my own consulting company called Frank J. Corigliano, PhD Psychologist. And I'm also very active on the state level with the New York State Psychological Association. I'm the clinical psychology division representative to the overall governing body. And, I also run a program called Supportive Televisiting, which operates out of the New York Society for Ethical Culture. And that's a program that also leverages technology to connect children and teenagers with their incarcerated parent through video. So those are my disclosures and affiliations. So I know a lot of folks are very interested in telehealth, and I know some of us feel like we could do something new and exciting, maybe a little bit dangerous, but we just don't fully understand how it's going to work. So that's how I felt my first time skydiving 2 years ago. As you can see that, well, you might not be able to see, but that is me attached to a more skilled skydiver. And if you look in the very distance, you can see the plane I just jumped out of. And even more exciting than that, you can see my cousin who jumped out of the plane without being tethered to someone else. And so a lot of us feel that way, especially when we're thinking about telehealth. We don't really know what it is. We think it's dangerous, but we're also very excited. So just level set, what is telepsychology? So when I'm talking about telepsychology, I mean the practice of telepsychology from a distance. And I'm talking specifically about live interactive video where doctor and patient can both see and hear each other and interact in real time. Also using a secure and HIPAA-adherent platform. So what I'm not talking about is store and forward, and I'm not talking about telephone sessions, although both of those might be relevant from some of the content I'm covering. What I'm focusing on is live interactive video. Picture of me sitting in front of my desk, and it has a picture of someone who could be a patient on the screen. So and that's exactly what it looks like. I also have a few video clips that we'll be able to show later on in the presentation. So who is Healthy Connection Psychological Services? So that's my company. I am New York based. So I know the area, and I know all of New York is not New York City, and I'm very committed to reaching out to all of New York State, providing the benefits that are available in the large cities to the smaller communities. Healthy Connections is psychologist-owned and operated, so I'm not owned by a tech company somewhere far, far away. I'm right here in New York, and I am a psychologist, so I'm a clinician myself. And I provide fully licensed psychologists. Psychologists I describe as we're the doctors you talk to. So there are two doctors who specialize in mental health. There's psychiatry, who tends to focus on medication management and writing prescriptions. And then there's the psychologist, who is the person you talk to work on underlying problems. We treat depression, anxiety, adjustment, ADHD, all kinds of things that people are working on. And also I focus exclusively on telemedicine, so I've never been in the same room with any of the patients, neither have any of my doctors for this company. And we're committed to rural New Yorkers. Although I'm based down in New York City, I grew up in the country in Florida, so I had an 1.5-hour bus ride to school. So this barn does not look too different from the barn that I had growing up. Now, again, to level set, what equipment is needed to start with telepsychology, and you can fold in any other telehealth service and typically I do encourage having multiple services. So a facility might start with telepsychology to do crisis intervention, assessment, diagnosis, and treatment of mental health issues. But you could also then fold in telepsychiatry or teledermatology or telestroke or any other services through video. What you would need is a computer, a webcam, a microphone, speakers, a strong internet connection, a HIPAA-adherent video platform, and a private space that's convenient for the patients to be brought to or the patients to get to. And those are basic setups that you would need to start a telehealth or telemedicine or telepsychology program. There are different types of telepsychology or telehealth or telemedicine. You can have institution to institution. For example, you might set up a link between Fort Drum and a skilled nursing facility, and they might connect with each other. You might have institution to individual. So you might have Fort Drum or Columbia University connecting to a particular patient and delivering services, either in their home or in a doctor's office. You might also have a individual-to-individual model, which is more of a practice model. So I imagine most of us on the call today would be individual to institution or institution to institution. And then finally, you want to think about whether you have scheduled or on-demand sessions. So typically, if it's a psychologist who's providing services into an institution, that's typically a scheduled session. For example, in a skilled nursing facility, I might have a doctor in that facility 2 days a week. And so it's typically maybe Monday and Wednesday, or Tuesday and Thursday, or Friday and Tuesday, whatever works for that facility. And those schedules are usually pretty fixed. That way the facility and the patients run on a schedule that they can predict and staff for, and they're there every week. Another model is to have on-demand sessions. So one of the great benefits and way to reduce costs is to be able to have that on-demand or quick access in the time of a crisis. One of the cost reducers for telepsychology is being able to have a psychologist do an assessment and during a crisis, which reduces costs of transporting a resident or a patient to a psychiatric emergency room, which once you put someone on a transport, either a van or an ambulance, that can raise costs by hundreds or thousands of dollars for each time that resident needs to be sent out. So some of the primary psychological services. So psychologists provide assessment. So they look at current or past psychological issues. They do crisis triage, especially in terms of suicidality or potential suicidal thoughts or suicidal comments a resident or a patient might say. Psychologists can go in there and assess that patient and provide information to the nursing facility about what steps to take. They might also do a post-incident evaluation, For example, if there's a resident-on-resident conflict, or if somebody's been hit, or if somebody's having behavioral issues, the psychologist can work on that evaluation and kind of get to the underlying issues. The second primary thing, in addition to assessment and diagnosis, is intervention. So individualized, consistent psychotherapy. The doctor and the patient meet and work together each week for weekly psychotherapy. And that's another way that really helps avoid crises from building up and becoming very expensive and very disruptive issues. Is if a resident is already in ongoing care, they're less likely to have a psychiatric emergency. And then we provide is consultation, supervision, and psychoeducation. So, for example, in services on identifying mental illness and developing appropriate referral strategy. So some people might think, who is psychology for? How do we identify residents within a facility? So certainly the obvious ones are anyone with serious mental health issues, level 2 residents, are folks who have a past history when we have an intake and we discover that they have a past history or currently are hitting on one of our mental health screeners, for example, a depression screener or an anxiety screener, those folks are typically immediately referred for psychological evaluation and the determination about whether or not they would benefit from ongoing care. And also, some of the softer things is noticing the folks who are not engaged the way we'd like to see them. They're not participating in activities. They're not having visits from family. They're the more lonelier, depressed, failure to thrive, not eating as well, not sleeping as well folks. Those are often great to get into therapy and help them become more engaged and more active and really thrive in their environment. And then, of course, the folks who have behavioral issues, physical aggression, verbal aggression, anyone who has inappropriate sexual behavior, those folks always get sent over to psychology to be able to work with them around their behaviors. And often we see a lot of change in figuring out what's driving those behaviors. So again, how do we identify psychological patients? It might be after a crisis, something happened. It might be that they're already on psychotropic medications and before having a psychologist or access to ongoing psychotherapy and psychological care, the only tool that most facilities really have is medication. So any of those folks who are on antidepressants, anti-anxiety, a lot of the pain medications, often we can reduce or eliminate those medications by introducing psychotherapy and psychological services, and also support gradual dose reductions from antipsychotics or antidepressants or pain medications by folding in psychological care. Also, as I mentioned before, any of the scores on the mental health screeners that are done on intake or periodic evaluations, and if somebody has a history of depression or anxiety. One of the benefits, looking at, again, achieving our goals is improving the patient care and patient satisfaction. So the patient journey with telepsychology means you're no longer waiting weeks or months for an appointment. You're not disrupting half a day or full day of activities because the resident is being brought off-site, put in a van or on a medical transport to get their psychotherapy. They can now have that delivered on-site through video. And you're not having to, especially in the North Country and upstate New York, we have the four-letter word known as SNO, which really does impact our ability to get patients out of a facility and to get providers into a facility. And it can be very disruptive this time of year, whereas with telepsychology, we're able to provide that consistent quality care each and every week without disruption. And also there's no uncertainty about who the doctor is going to be because we're always beaming in the same person. You're able to develop a relationship with your doctor. You're not getting a mix of doctors who might be available at the time. And I know there is a lot of turnover with clinician care and doctors in the rural areas trying to keep those staffing levels or staff members consistent. So how does it work? The process, very quickly, is the treatment team identifies a resident for potential psychological evaluation. The director of social services or director of nursing will present that resident to the psychologist. The psychologist will conduct the evaluation and provide diagnosis, let the facility know what's going on with the resident. And then we provide the evaluation and make a recommendation. Is this resident someone who's going to benefit from ongoing psychological care and psychotherapy? If so, then we make that recommendation and the resident is added to the weekly schedule. And typically between 15 to 20% of skilled nursing facility residents have a significant psychological need and are appropriate for psychotherapy. So we want to make sure that their memory and cognitive function is intact enough so that they can benefit from talk therapy. And what we find is typically it's between 15 and 20% of the residents there. Reimbursement is a big conversation. So Healthy Connections, we typically bill the Medicare insurance directly. So typically there's a monthly consultation fee that the facility pays, but above and beyond that, we bill the of the resident directly. So the facility is not getting a direct cost for each and every resident. And there are different models. Some providers will bill per hour to the facility, and that works better. But my model in general is billing the Medicare directly for the facility. And that really does help reduce the cost, because suddenly a facility is able to get pretty unlimited psychological care for many of their residents at a minimum cost to the facility. And to talk about that further, if need be, for those who are interested. So how much telepsychology is right for you and your residents or your patients? So for some folks, it's going to be full telepractice. They're going to have a full psychology service, and that's typically 2 days a week. The psychology will beam in. There's usually a telemedicine room set up, and that has the computer, the speakers, the microphone, the screen TV, and the residents are brought in, and that's the way it works. For some facilities, it might just be special services. So, for example, crisis intervention or very high-need level 2 residents only, or for special sessions when something happens. So there is a range of telepsychology that might or might not be right for each facility. That can be really tailored. Another picture, sort of a general screenshot of what it might look like for the provider's end. So this is me working in a home office. And I have the picture of the patient on the screen. And I'm able to work from a home office, which really does, again, with that fourth goal for healthcare reform, is improving provider satisfaction, efficiency, and reducing burnout. If we can access suddenly psychologists from throughout New York State and bring them into rural communities to provide services, we're much more likely to be able to keep those clinicians happy, engaged, and for the long term. This is briefly some of the assessments that can be done. Certainly triages, suicidality, level of care, determination, safety determination, violence issues. Different interventions is typically psychotherapy, pain management, medication management. We work with the prescribers to help reduce those when necessary, or provide support when there's gradual dose reduction, or provide psychotherapy in addition to medication. We work collaboratively with our prescribers. And then coping skills training and family integration, helping folks adjust to becoming as independent as they used to be, not as connected with family. We also provide supervision on grief care. We can do case presentations, individual or group supervisions. We can provide into medical facilities. We can beam into medical facilities or skilled nursing facilities and provide those sort of supports for staff. How does staff talk about mental health issues? How do we language behavioral health issues? How do we identify and refer appropriate residents or patients for psychological treatment? Again, this is some other issues. For example, how do we deal with life after death when people are living with death on an ongoing basis? How do we reduce reliance on opioids? What are the signs and symptoms of mental illness? Overall, I wanted to just talk about ways to reduce costs. So one of those is having a service that bills the patient's insurance directly, reduces the cost on the skilled nursing facility, reducing emergencies, reducing unnecessary hospitalizations, reducing unnecessary transportation costs. Those reduce costs to the facility, and also reducing the burden on the highly trained, high-need staff. So when somebody is having mental health issues, often those are the people who are spending a lot of time drawing down the resources of the nurses, of the director of social services. So all those people can now have a resource of a psychologist to talk to each and every week. And so that reduces and manages the burden of the nurses, the nurses' aides, and the director of social services. Suddenly that frees them up with a lot more time to do their primary tasks. Also, increasing the of the residents and increasing the provider satisfaction. So looking at those three things: reducing costs, increasing patient care, increasing provider satisfaction, and also addressing population health so that all New Yorkers have access to really great quality psychological care. So with that said, I think we have a couple of video clips, and then I'm available for Q&A, or I know there's some other updates as well.
Do you intend to share video clips on your end? All right. Hold on 1 second while we figure out the video.
Okay, great.
Give us 1 more minute while we get those videos pulled up.
And then meanwhile, if you want to, we can take any questions.
Sure. While you're getting that set up, we did a couple of questions. So you bill Medicare or the insurance directly so that the facility you're working with gets appropriate reimbursement. How do you then get paid? Do you enter into a contract arrangement with each facility you're with?
Question, sure. So in general, what I do is I have a contract with the facility for a consulting fee, which is a monthly fee. And then for the each individual patient, we bill the patient's insurance directly. So Connection Psychological Services bill the patient's insurance directly and paid from the insurance.
And in your experience with telepsychology, do most insurances reimburse for this type of service, or are there ones that stick out that deny it?
And that is there's a bit of an art and a bit of a science, and it's a lot of a moving target. So some insurances will cover it. We are, in theory, in a telehealth parity state. So many of the insurance are supposed to cover it, but that it really is insurance by insurance company.
We found the same in our experiences as well. Another question, would the skilled nursing facility have to purchase specific equipment or software that you recommend, or do you work with software platforms?
Sure. So similar to folks today, it used to be where we all had one kind of text messaging, and now if you talk to anyone, they're using 5 different text messaging platforms, and nobody emails anymore unless it's a professional thing. But generationally, people are just used to using multiple platforms now, And so we're also finding that with the telemedicine is that there are several platforms out there that work great. So it really depends on who I'm talking to, which platform I use.
Okay. And next question is, can mid-level providers bill out codes 90791 and 90834?
Mid-level, that I think you're generally talking about like master's level, so that's usually your social workers. And I think that might depend based on the insurance company. For my company, I use all doctors, so we're all doctoral level, and that's where, at least initially, that's where the insurance companies are looking.
Okay. And the next question and last question for now is, are you able to attend team meetings and communicate with the psychiatrist or nursing home attending on a regular basis?
Absolutely, and that's where some of the consultation comes in and the consulting fee covers is we generally meet with the director of nursing or director of social services on a regular basis to review referrals and review how the patients are doing. And we also do send a note after each session that goes into the patient's chart.
We did get a couple more questions. Does the facility where the patient resides require a camera that supports pan, tilt, zoom functionality?
Repeat that one?
Yes, does the facility where the patient is residing require a camera that supports pan, tilt, and zoom functionality?
So that has come up in a couple of situations. The most recent, and Katie, you might remember the details as well, is that they're looking to move away from requiring pan, tilt, zoom functionality, just because a lot of the technology now is becoming internet-based, and they really want to open it up more, and a lot of folks aren't going to have access to those cameras. So it's a great thing to have. I think the regulations are moving away from requiring that.
Yeah, I agree with that. That's helpful to know because I know that has been a bit of a barrier in the past.
Yeah.
There are no other questions, so if you have those videos up, we can certainly share those with the attendees.
I'm still looking for those. Oh, wait. I should have just found them. Yes, I did.
How are you doing today?
What? So just by way of introduction, this is,
it's nice to see you.
I'm just going to show, I have several clips. I'm just going to show you one that shows me beaming into, this is actually a person's home, and the person has their daughter with them, who is helping them with the session. The daughter's off screen, so you're not going to hear her as much, but you might see her there. But this just shows you how interactive and real it can be. Lighting's not good, but with that, I think it's a really nice demonstration. So can you see my screen?
Yes.
Okay, here we go.
How are you doing today?
Pretty good right now. It's nice to see you and smiling.
Oh, yeah, it's nice when you see someone.
And I have one of my daughters here.
Okay, and who's your daughter?
Yeah.
Oh. I'm a psychologist, and I specialize in telemedicine.
Oh, brother.
So what that means is I'm able to use video, like we're using right now, to meet with people each week to do therapy.
Oh, you can talk to us instead of traveling to go talk to someone. You can do that. Oh, I have to remember that.
And what I do as a psychologist is I meet with people one-on-one once a week and help them work on things to improve their life. So